Hi, this is Dan Olson, and I'm here to cover really some of the foundational policies associated with our records management system, the new system, ESO Solutions. When we're implementing this, we're also bringing forward policies and procedures to accomplish it and how to function within the system. You're going to hear quite a few and see quite a few videos that become available that deal with really more the tactical, how to operate within the system. I'm really here to talk about the policies themselves and what we expect and what we are trying to achieve with the system. So on the screen you should see that great title, Policies, and I'm just going to walk my way through them and explain them as I go. The first one is an accurate and complete incident record shall be completed and maintained in the VFD's RMS for all incidents occurring within the VFD service area and our scope of service, all incidents where the VFD is dispatched outside of its service area, and this is an important caveat: if there's a doubt about whether an incident report should be completed, the default shall be to complete an incident report. So what's that all about? In its end state, we have to have a report to meet our legal requirements. You'll see in the next bullet, whether it be a fire or an EMS incident. We need it for patient care and documentation and quality assurance. And then the last issue is for the data needs that we have for analysis and reporting. If we think of writing an incident report as something that's a necessary chore, I think I definitely understand the perspective of that, but the reality is if we do not have good incident reporting and we don't have the ability to articulate in the language of government, which is really in the language of measurement and data, our ability to meet our needs today and in the future are going to be dramatically reduced. The world has changed. It speaks in this format of fact and good quality reporting, and it is essential for us to do it. In fact, I would even say at to this point, if you're looking at doing reporting as a basis of doing the minimums always, maybe pushing against the envelopes of these policy statements or trying to get out of reporting, what you're really doing is you are inhibiting the organization from being able to meet its future resource needs and to be able to explain the service level that it can currently provide and what we're going to face in the future. And I think as you're looking at this, I know most of you want to fulfill your responsibility, but I want to take it to that. It's not just a responsibility, it is a responsibility for the requirements I've just covered, but it's really about us reporting and explaining what we do and why and when. So I want you to think about that as we walk through this reporting. Because in the end state, if we don't have accurate data, we are not going to have an accurate picture of the services we provide, and we're not going to be able to report and explain what are the current conditions, the future conditions, and our future resource needs. So that statement under that if there's a doubt, report, I think that really brings it into a perspective. So third bullet under policies is the strategic incident commander is responsible for the accurate completion of incident reports. So the question would be is who's the strategic incident commander? Well, on a EMS incident, if it's one unit, it's the captain. That's the person who has both the strategy of the incident and has overall command of the incident. At a fire, it's the incident commander generally is the battalion chief, the individual who has assumed that strategic command position and directs the incident. So that individual is responsible for the report. That doesn't mean that they have to do the report, but in the end state, they're responsible for the product of that report. If someone else writes it, they're going to have to review it because they have to sign off that it is an accurate and complete report reflecting what occurred at that incident. The assigned report writer is the person who's responsible for the accurate completion of the EPCR. The EPCR is the electronic patient care record. and there's an assigned report writer. Generally, it's going to be the lead medical provider who is responsible to complete the report for each patient. Our next bullet says once the report is locked, only the strategic IC, the person responsible for the report, the VFD investigator who has a business necessity to go into that report, may change fields in the FHIR module. So we're tightening up this locking because we're looking for reporting that has integrity and that we can say, no, that is what was reported. So in the FHIR module, it's the strategic IC and the VFD investigator. And then the assigned report writer in the EPCR module, because again, this is the person who's writing the report specifically about a patient, and they're attesting that this is correct and true. When we make any changes in any report, once it's been locked, we are going to require that documentation needs to occur regarding those changes into an appended narrative for each change that occurs within the report. What we're trying to do is create a very transparent and easy to understand record of changes that occur, especially after the report has been locked. A FHIR module report must be completed for all incidents. You're going to see that there are two main modules within the system itself. The FHIR module is the main module of the reporting system, and a FHIR report must be completed for every incident. So the confusion comes, well, it's not a fire, but we're the fire department, and the concept is, from an in-first perspective, is if we're the fire department, if we have an incident, something goes into the FHIR module. So for every incident that we respond or attend, a FHIR module report must be completed. Now, a FHIR and an EPCR module, the EPCR is the electronic patient care report, which is the second module. We just talked about the FHIR, now we're talking about the second module, the EPCR. Both of those modules must be completed for all incidents where a patient exists. And we're going to explain a little bit further about what that means when a patient exists. In particular, because it impacts when you have to do an EPCR. Our next bullet is when an EPCR is required by the VFD. It's required when, number one, if the VFD is the medical team leader assigned to the patient, and there's a few conditions. There's a mechanism of injury. There are signs and symptoms indicating a new onset of illness. There is deterioration from an existing illness. Anytime VFD personnel participate in patient assessment, anytime VFD personnel provide any form of patient care, and again, that last caveat, if there's a doubt as to whether an EPCR should be completed, the default shall be to complete the EPCR. So when you look at that, it's, if we're the medical team lead, so as an example, we get there first and our paramedic is the team leader. If any of these things exist, we've got to do an EPCR. If we literally assess a patient, if there's anything that we need to do for that patient, we need to do an EPCR. Second circumstance is if another agency is the medical team leader for a patient and VFD personnel participate in patient assessment or treatment, we have to do an EPCR. If there's, again, any doubt as to whether an EPCR should be completed, defaults to complete it. So you can see this EPCR module, it's really a place that we have to report when there are these conditions met. The FHIR module, regardless of the EPCR portion, has to be filled out each and every time. So the next question would be is, when is an EPCR not required by the VFD? Because there's calls that we go on that this criteria may not be met, but we thought it would be prudent to express in as clear a way as possible when an EPCR is not going to be required. So the first kind of condition is when a VFD employee is the medical team leader and there are no potential mechanisms of injury, no signs or symptoms of illness indicating the need for a patient assessment. So a good example of that is you drive up, you can see it's a fender bender, everybody's outside, everybody's saying we're fine, there's no problem here. So we wouldn't need to do an EPCR because we don't have a patient. calls that you would go to where an individual needs logistical assistance only. As you know, people are calling 911 for various things. Sometimes they just need a little help. Maybe it's getting back into bed. Maybe it's moving from one location to another. If they don't have any mechanisms of injury, any signs of symptoms, any deteriorations of illnesses, etc., and no patient assessment and no patient care is needed, you do not need to fill out an EPCR. Next, it's when another agency is the medical team leader and VFT personnel only provide logistical assistance to the transport agency, like assisting patients in the patient egress, acquiring patient information, or carrying equipment. So if you're there, you're helping AMR, they arrive first, you're there, you're helping them get the patient packaged in the back of the transport unit. Maybe you grab some information about the patient. No harm, no foul. No reason to do an EPCR. If you also did that, and then maybe you acquired a blood, or you actually performed a blood pressure for the patient on the patient under the direction of the lead medical provider, the transporting medic, but you're not providing any analysis or any other procedures, then again, you don't have to perform, or you don't have to provide an EPCR, because all of that is documented on their EPCR. And then lastly, if you're involved in an incident where you're performing a rescue function without patient care, so you're utilized to perform extrication of a patient from an automobile, but again, you're not performing any patient care, you're only using the tools. Or if you're using a rope system to bring a patient out, but again, you're not performing any form of patient assessment or care, then again, an EPCR is not required by the VFD. If the last bullet is, if an EPCR is not required, all unit activities will be reported on the parent, in the fire module, the parent basic, and then the child narrative tab, following the format that we have in an attachment in the policy. So if you look at overall, what are we trying to achieve here? We're trying to get a report to document our incidents for many reasons. We have legal requirements, we've got patient care requirements from the medical program director, and we also need data needs in order to report our future and project our future, both reporting service levels today and our needs of the future. The rest of these is really setting the structures of the who, what, when, of how and when we have to do an incident report. So really this summarizes the main policies. I'll be hitting a few additional ones in the next module. Thank you.